Goodlatte.
Thank you, Mr. Chairman. Dr. Gottlieb, I think you wanted to explain your answer with regard to the trends with regard to insurance premiums, and I think you should be afforded that opportunity, so I'll give that to you now.
Thank you, Congressman. What we've seen in the market and what the administration often talks about is the cost of coverage, of providing coverage for employers to their employees and premium growth. And it's true that premium growth, at least in the recent years, has moderated, although we're seeing it accelerate quite dramatically. But what's happened is we've seen a very dramatic shift of cost to consumers. We've seen the advent of very narrow network plans, closed drug formularies, closed networks, exclusive provider organizations, and all of that has served to shift costs onto consumers. And I think that that's a big
Things that aren't covered by the insurance, in other words.
Exactly. If you're
so the opposite of what was purported to be the benefit of Obamacare.
Well, closed drug formularies in particular is a real new phenomenon in the market. The only place where we had seen closed drug formularies prior to implementation of the Affordable Care Act was in Medicare Advantage, but Medicare Advantage had the protected classes which made sure that the formularies were robust. What's happening in the Affordable Care Act and the exchange-based plans is there's closed drug formularies where if the drug isn't on the plan's formulary, you're completely out of pocket, and what you spend doesn't count against your deductible.
So I need to take my time for other things. So what you're saying is that whether or not insurance premiums are moderating, that doesn't necessarily mean that the overall cost to the consumer and overall cost to society,
Exactly.
overall cost to taxpayers has moderated.
It's gone up quite a bit to the consumer.
Great, thank you. Dr. McEnany, I may come back to Dr. Gottlieb if I have time, but he said that health system ownership of medical practices is an undesirable trend. You said that you wanted to make sure that they had choice. In a moment, I'll go to Mr. Pollack and give him an opportunity to respond as well. But one of the things that I see and one of the things I hear from my physicians is that it is they're actually in competition with the employees who are at the hospital, and it is very difficult to compete with them when there are such disparate reimbursement rates that take place in the hospital compared to what the physician may get in their private practice. What's your observation about that?
Well, Mr. Chairman, I think you summarized it very well, that it is very difficult for individual physicians to be able to compete with hospital-based physicians because they have the leverage that we as individuals lack to be able to negotiate with insurance companies. We find that the regulatory burden is still there in the independent market, and that hospitals are able to purchase a lot of the same supplies and everything else that we need to purchase at a lower price or a subsidized price.
Mr. Pollack, I take your point regarding the cost of operating a hospital, but I also am concerned that if we're trying to promote competition and there's only one hospital in a community and that hospital has people providing a service in this area, how do the private practitioners successfully compete with the hospital practitioners, if you will, in that kind of marketplace? And what are the trends there? I see a lot of consolidation. I think Dr. McEnany said it already at 70% perhaps of physicians going into work in hospitals. Where do you get the competition if they all go into the hospital and nobody's out there providing that competition?
I think some of the competition is among hospital systems. And I think what we have to remember here is that we have a new way of paying for a lot of care in terms of different mechanisms that require payment for taking care of.
What if there's only one hospital in the community?
By the way, you made an eloquent point at the very beginning, Mr. Chairman, about how healthcare is a unique kind of market.
I agree with that.
There are 13.
But I'm not going to let you off the hook on that.
No.
We still got to find ways to compete.
But your point's very well taken. There are 1,300 critical access hospitals in this country in which there really is not competition. There are another 500 or so sole community providers or rural referral centers. So inherently, it's hard to say that competition plays out in a very even way.
Competition amongst hospitals is an important issue, and we're going to get to that as a part of this series of hearings that we're going to hold. But right now I want to talk about competition between doctors working in the hospital and doctors who are working outside the hospital. How do we promote that? How do we assure that we continue to have competition from physicians who want to practice on their own, or from a societal standpoint, from an economic standpoint, it's important that they be outside the system and practice on their own.
And I think that that pluralistic approach still exists, that is out there today. But I think what's important to recognize is that there are a lot of physicians that want to be in practices that are group practices, whether they are on their own or whether they're in employed arrangements. And there are a lot of physicians in the next generation that are coming out of medical school that actually want to be a part of these groups because they don't want to take calls 24/7, and they want to be part of these teams.
Mr. Chairman, if I might, I'd like to let Dr. Gottlieb answer the same question that I just did.
Without objection.
Mr. Pollard. Well, the question is, how do we assure continued competition when in communities that have only one hospital system, when the fact of the matter is more and more physicians go to work in the hospital and take up that competition?
I think we don't, and I practice in one such community where I think when the hospitals monopolize most of the local physicians, it's very hard to have provider-based competition. And I do believe that provisions in the Affordable Care Act have skewed the market in this direction, quite deliberately so. I think it's part of a broader political philosophy that I think to date hasn't been successful.
Thank you, Mr. Chairman.